Now you know. Now you know. If you know, you know. The big ballers in town. Now you know. Now you know. Forget what they know them. Yes. Agbabola. How much is money?
It's nothing.
Ballin'. Premium or nothing. Now you know.
Now you know.
Now you know.
Now you know.
Forget what they know them. Yes.
Very quickly, I would like to invite the ACPN National Chairman, Pharm Ezeh Ambrose, to come forward, sir. ACPN National Chairman. Please, can we appreciate the National Chairman of ACPN, Pharm Ezeh Ambrose? Thank you so much, sir.
According to Thomas Carlyle, great leaders are born, not made, suggesting that history is shaped by individuals with inherent leadership qualities. Some leaders emerge through circumstance, while others are called to serve, a testament to their character. Such is the case with Pharm Ambrose Ezeh, whose leadership style reflects a commitment to service and a vision of brighter days for those he leads. A detribalized man, a man with an uncommon passion for the pharmacy profession. A native of Afa in Udi local government area of Enugu State, Ezeh was born on 1st of October 1976. After his elementary education at Amofia Imesi Community Primary School, Afa, and secondary education at Technical Secondary School, Amofia Afa, he proceeded to the University of Nigeria, Nsukka, where he graduated with the Bachelor of Pharmacy degree. He obtained a Master's in Public Health MPH degree from the Lagos University Teaching Hospital. He has also bagged several other professional international certifications, including the Certificate in Principles of STD HIV Research from the University of Washington. Ezeh had his internship training at Jos University Teaching Hospital, Plateau State, where he developed a deep understanding of patient care and fostered meaningful connections with patients. Ezeh Ambrose is a healthcare professional with a tenacity of purpose. His enthusiastic and approachable nature have made him enjoy excellent working relationships at different levels. Since 2008, Ezeh has dedicated himself to improving the health and well-being of countless individuals. He has also been a committed member of the Pharmaceutical Society of Nigeria, PSN, the Association of Community Pharmacists of Nigeria, ACPN, and other professional associations. In his 15 years of practice as a pharmacist, he has served the PSN and the ACPN in various capacities. Aside from serving as a committee member at national and state levels, he has also been Publicity Secretary, ACPN, Lagos, Financial Secretary, ACPN, Lagos, National Treasurer, ACPN, National Secretary, ACPN, among others. An advocate for good pharmacy practice with a track record of role modeling and mentoring the younger ones in business decisions, Ezeh has received several meritorious service awards and recognitions to his credit. These include being a Merit Award winner of PSN Lagos and many others. Ladies and gentlemen, invited guests, it is my singular honor to present a detribalized man, a lover of community pharmacy, and a great leader, pharmacist Ambrose Ezeh, National Chairman of Association of Community Pharmacists of Nigeria, ACPN.
Thank you very much. The chairman of this occasion, my own immediate past national chairman, Prince Wale Oladibolo, the fellows of Pharmaceutical Society of Nigeria are present. I can see many of my mentors here. I'll mention a few names. Pharmacist Fasisi, I will not call the other second name. You recognize her? I can also see my first mentor in the pharmacy profession, as when I finished my internship. My second mentor, let me say okay, because I started with internship, then went to before service in Oyo State, and now the director of pharmaceutical services, Oyo State, Pharmacy Gary. Thank you very much. I also see one of my mentor and mommy, pharmacist Salahu. I don't know the second name. I forgot. I don't want to mention it. You recognize Ma? Then other distinguished guests, fellows, especially from Lagos, my mentors, APO, Bolagade Yola, Oladibolo, Olubowale, and many others. You welcome, sir. The PCN officer, you welcome. State chairman, especially from Kuala, you welcome. The leadership of Oyo State and the distinguished colleagues. It is with great pleasure that I stand warm greetings and goodwill to the organizers, especially, and the participants of this ACPN Oyo State Summit. I want to commend the organizers, especially that invited me for this occasion. Healthcare landscape is undergoing unprecedented transformation, driven by technological advancement, evolving patient expectation, regulatory reforms, economic pressures. In the midst of these changes, community pharmacies must continue to look beyond traditional dispensing rule and position themselves as an indispensable healthcare providers, innovators, and trusted custodian of public health. Three things are there. We'll talk about ethics. If we know what is ethics, ethical standard, we must stand within ourselves, stand in our family, in our practice, and the people we see. We discover what is good, distinguish between the artificial and reality. We'll talk about technology, yes, data delivery, data generation, and so on and so forth. This is the key aspect where we must focus on. And that is why ACPN and the additional secretariats and our wisdom of National Executive Committee and NEC, we embark on what? Capacity building, multi-capacity building, which we do every month. We started from February, and I know many of us have been participating and also benefiting. This month is going to be one on digitalization and technology, and we have a lot of resource people that have been doing that. And I want to also recognize this junction, my own brother, my own friend, Tafi Odukoya, who's, I know his PhD, participated as a resource person in capacity building. And we all know that you're also going to help us. You're going to do more at the national conference because we know the stuff is made of. These are the people who believe, cooperate with us. Whatever we are doing or whatever we are achieving at the national level is not only as the Ambrose Ezeh Remark that is doing it. It's all of us that are doing it. Innovation is then a enormous opportunity for community pharmacists to improve healthcare delivery through digital solution, medication therapy, preventive healthcare services, data delivery, decision making, patient centers, and all that. If you are keeping record of whatever we are doing, that's why I advocate record of what we are doing, data generation. That can only thing we can contribute that will make policy changes. Because whenever we are there in any stakeholder meetings, I'll make a statement. I've said that community pharmacists are more than over 8,000 in our national portal. And they'll be thinking, I'll just open my laptop and say, see our data here. We can generate data any day, any moment, and that's what will be in the industry. And that's the only way we can contribute our own quota. And they begin to see what CPs are doing as a critical stakeholders in the healthcare delivery system. So this is very, very important. And I want to answer a question. Are we keeping record of whatever we are doing? We are asking for fee of service and other things with the mind. Are we keeping records? If PCM, which I will hold responsible any day, anywhere, because they are in charge of what? Our education and practice. It is high time they begin to demand from community pharmacy what you are doing. Where is the data? What are you doing? Where is the work you say you are doing? If you are practicing, it's very, very important. So that when they are there in national council meeting, the registrar is always there in that meeting. He will provide the data. He will say, this is the data of my members, my community pharmacists. This is what they are doing in the community. And they will see what we do and begin to listen to us. So it's very, very important as we do that. As a leader and practitioner, we must also recognize that sustainable growth is essential for survival and prosperity of community pharmacy. In pharma sector, community pharmacy contributes significantly to the healthcare access, job creation, economic development. I know number of people, Vanguard Pharmacy, let me use him as a number of people it works as far as job creation, workforce, and all that. I know, and I know each and every one of us who can, if we can correct it and say in Oyo, this is the number of people we engage, and this is how we are contributing to GDP or contributing to economic growth and all that. So it's very, very important if we are keeping record of all those things, and that is why we are the most accessible healthcare provider. It is on data, it is on record that 70% of the citizens go to community pharmacy without before going to clinics. True of us, 70%. It is not my research, it's the WHO research. They go to community pharmacy. That shows what you can do, and are you keeping record of those who that visit you? I know my fellow there in Oyo State, Faith Pharmacy, that are managing our pharma care in Oyo. I know the kind of record is keeping. I know what they have done in immunization. I know what they have done in any public health care intervention, and that is what is meant for all of us to be doing. So I encourage us to do more and collaborate more. So I encourage all the participants here to actively engage in a discussion here, share experience, develop practical strategy that will strengthen our profession and position community pharmacy for greater impacts in Nigeria healthcare system. The other section I want to make comments, because when we come for this kind of function, I deliver my speech, my goodwill, remarks, and information that are happening in the national secretariats. We know our conference is forthcoming. How many of us have registered? Our national conference is going to happen in what? Ahmed Bola Tinubu International Conference Center. That is where we're organizing our conference this year. and it's going to take place 27th of July to 1st of August. 1st of August is a departure day, is a Saturday. It will end up that 1st of July at International Conference Center. Have you registered? And from the team, we say the team is going to be from community, local pharmacy practice to global impact, managing complex political system. That's the theme of that conference. We have gone the island of what? Counting paracetamol. We should begin to think about what? Counting impact. If you are there at the national conference of PSN, the keynote speaker gave us that we should stop counting paracetamol and begin to count impact. And that's the only thing that can make us relevant. And if you are a community pharmacist and you are sitting here and people are not calling you for this or that in medication, you are not creating an impact. You have not started. So these are the things we should begin to look forward on that. And I will continue in advocacy. We know we have 4-point agenda. When I sit before you and say, this is what we are going to do. We talk about what advocacy. We know, see what we are doing in advocacy to make the pharmacy profession known to the public. We also done well in what? In welfare. We are making remarkable there in welfare. And our pharma care continue. We continue to build on the pharma care so that those who understand will see the relevant of what community pharmacy practice on what we are doing. Digitalization. In this conference, we have a robust application we are going to want to introduce. And I know each and every one of us are no more using analog. They are all using digital solution, different digital solution. We try to manage that. That is the only way we can keep record. We can do healthcare services more optimally. So I encourage us that we continue to do. Before I leave this podium, I want to state on critical standard what is happening in community pharmacy. For community pharmacies owners are the words. They have pushed them to the wall so much. Because of unethical practices, we are doing both the old and the young. Especially when we begin to talk about selling of our licenses instead of what? Selling licenses and demanding for what? For salary difference. Without knowing that your license, I'm asking the PCN, is the ethical entity, is the legal entity that will make you to practice. You cannot go to Vanguard Pharmacy and you now charge Vanguard to pay for the license and also pay your license. That is what is happening in our practice today. Why some of members of pharmacy profession and more panicking some of pharmacy owners don't work here, don't go here and all that. Why some are having their own POS entering into a pharmacy. You are not a pharmacy owner but you have POS so that you can divert privilege and all that. That is an unethical standard. And that will lead to a fall of our profession. So as a leader, what are you doing? We should begin to think what you should do so that posterity will always protect us. So at the end, you say that as a leader, I finished my own. This is what I did. You remember our forefathers, how they started. And you are now a leader and all that. You must do collectively to fight against these unethical practices we are doing. So at this juncture, before I need to also recognize the National Executive Council and NEC or PSN, because we have pharmacists. Ajibade is here as in National Executive Committee or Council or PSN. So in as far as we are concerned, you're supposed to have represented PSN present and make a comment. Another protocol, you can only sing PSN anthem when the president is available, or if there is somebody who is representing the president. And I believe that if this thing has been well organized and Ajibade is here, you're supposed to have represented president. And when we are doing it, we know that we are doing everything holistically. We are what? Following the ethic and the standard of the profession. That is an advice. And also, as my national chairman is there, they are supposed to understand the ethics if you are informed and understand the culture and the tradition of the pharmacy profession. Because the most organized pharmacy profession. So we should not use our personal aggrandizement or personal ego to destroy a profession that built since 1927. That's going to be 100 years next year. As a centenary, we are going to celebrate awards at Abuja. So whatever you are doing on a personal note, you always recall what is going to be the prayer or what is going to be our forefathers that have done this, laid this foundation. What are they going to do? And if we do that, we should continue to strengthen ourselves. We continue to ask God Almighty to strengthen us in whatever we are doing. So at the end, all of us will have cause to merit heaven. Thank you, Oyo State. Thank you, my people. And I think at this time, Joshua, I will take my leave for personal reasons, and I wish you well for this conference. Thank you, and God bless you.
Now you know.
Now you know.
Now you know.
Undefeated, undisputed, unopposed, luxury or nothing. Money is talking, money is talking. Blessings on blessings. Forget what I know them, yes. Agbabola, how much is money?
It's not